Muscle cramps are a common and painful sensation experienced by many people. They can range from a mild discomfort to a debilitating pain and can occur anywhere in the body's muscles. Understanding the science behind muscle cramps, their types, and their triggers can help individuals prevent and alleviate their occurrence naturally. In this video, I will discuss what muscle cramps are, why they occur, and ways to prevent them naturally. Welcome, I am Dr. Jenny Murray, a chiropractor in Colorado. On this channel, I want to provide you with tips and strategies to live a healthier life without the use of drugs or surgery. Muscle cramps are sudden, inexplicable, and involuntary contractions of the muscles. They can affect one or multiple muscles simultaneously, often causing a sharp and unbearable pain. Muscle cramps can last for seconds to minutes or even longer in severe cases. If the cramps continue for an extended period, it is essential to consult a healthcare professional as they may indicate underlying health issues. There are primarily two types of muscle cramps. The first one is skeletal muscle cramps, which occur while a person is exercising or engaging in any physical activity. These cramps can occur in various muscle groups due to factors such as improper warm-up, dehydration, electrolyte imbalances, and overuse. The second type is nocturnal cramps, which occur primarily at night or while a person is sleeping. Nocturnal cramps can be due to several reasons such as dehydration, nerve compression, muscle fatigue, and nutrient deficiencies. There are numerous factors that can trigger muscle cramps. Some of the most common triggers are: Number 1, dehydration. Dehydration can lead to an imbalance in the electrolytes in the body, causing muscle cramps. Dehydration happens when your body does not have enough water to keep it functioning properly. When your muscles don't have enough water, they can start to cramp up or spasm. Other symptoms of dehydration can include fatigue, dizziness, and dark urine. Think of your muscles like a big, thick rubber band. If it's well hydrated, it's flexible and can stretch without any problem. But if it's dry and brittle, it's more likely to snap. The same goes for your muscles. When they're well hydrated, they can move easily without any cramping or pain. But if they're dehydrated, they can start to spasm and cramp up. To prevent muscle cramps, make sure you're drinking enough water before and after exercise. Try to drink a few sips of water every 15 minutes during your activity, especially if you're doing something that makes you sweat a lot. You can also eat foods that are high in electrolytes, like bananas and coconut water, to help replenish your body's fluids. Remember, staying hydrated is key to avoiding painful muscle cramps. Number 2, nutrient deficiencies. Nutrient deficiencies and muscle cramps are linked because certain nutrients are necessary for the proper functioning of muscles. The most common nutrient deficiencies associated with muscle cramps are electrolytes, such as sodium, potassium, and magnesium, as well as vitamin D and calcium. Electrolytes help regulate muscle contractions, and a deficiency in them can cause muscle cramps. This may occur during intense exercise, hot weather, or when fluids are lost through sweating. Similarly, a lack of vitamin D can lead to muscle weakness and cramping, as this nutrient aids in calcium absorption, which is essential for muscle contraction. A deficiency in calcium can also cause muscle cramps, as it is involved in the communication between nerves and muscles. In addition, a lack of magnesium can lead to muscle cramps as it aids in relaxing muscles and promoting blood flow. Overall, nutrient deficiencies and muscle cramps are linked because muscles depend on certain nutrients to function properly. Ensuring adequate intake of electrolytes, vitamin D, calcium, and magnesium through a varied and balanced diet is important for preventing muscle cramps. Number 3, fatigue. Overuse of the muscles with inadequate rest or sleep can cause muscle cramps. Muscle cramps occur when our muscles are fatigued and overworked because they become depleted of the necessary nutrients and minerals to properly function. When we exercise or engage in repetitive manual labor, our muscles contract and release repeatedly, which can result in a buildup of waste products like lactic acid. This buildup makes the muscles more susceptible to fatigue and cramping. Examples of everyday situations that can lead to muscle cramps include running a marathon without proper hydration, standing for long periods of time without breaks, or typing on a keyboard for hours without stretching. Number 4. Medications. Certain medications such as diuretics, statins, and blood pressure medications can cause muscle cramps as a side effect. Number 1. Statins are a class of cholesterol-lowering medications. These drugs can inhibit the production of CoQ10, which is an essential nutrient for muscle function. Without enough CoQ10, muscles may become weak and prone to cramping. Taking CoQ10 supplements or switching to a different medication may help alleviate muscle cramps. Number 2. Antipsychotics are used to treat mental health disorders such as schizophrenia and bipolar disorder. These drugs can cause muscle rigidity and spasms, which can lead to muscle cramps. Switching to a different antipsychotic or reducing the dosage may help alleviate this side effect. Number 3. Certain antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, can cause muscle stiffness and cramping. This may be due to the drug's effects on serotonin levels, which can affect muscle function. Switching to a different antidepressant or reducing the dosage may help alleviate this side effect. Number 4. Diuretics, also known as water pills, are used to treat high blood pressure and other conditions. These drugs can cause electrolyte imbalances, which can lead to muscle cramps. Eating a balanced diet and taking potassium supplements may help alleviate this side effect. Number 5. Beta blockers are used to treat high blood pressure and other conditions. These drugs can cause fatigue and weakness in the muscles, which can lead to muscle cramps. Switching to a different medication or reducing the dosage may help alleviate this side effect. Number 6. Steroids are used to treat a variety of conditions, including inflammation and autoimmune diseases. These drugs can cause muscle weakness and cramping, which may be due to the drug's effects on protein synthesis and calcium metabolism. Gradually tapering off the medication and taking calcium and vitamin D supplements may help alleviate this side effect. Number 7. Antihistamines are used to treat allergies and other conditions. These drugs can cause dehydration, which can lead to muscle cramps. Drinking plenty of fluids may help alleviate this side effect. It is important to talk to a healthcare provider about any concerns regarding medication side effects, and to not stop taking any medication without first discussing it with a healthcare provider. Number 5. Certain health conditions can cause muscle cramps. Number 1. Peripheral artery disease is a condition where the arteries that supply blood to your arms and legs become blocked or narrowed. Muscle cramps in your legs during physical activity may be a symptom of PAD. Some other possible symptoms of PAD include leg pain or numbness, hair loss or slower growth on your legs and feet, and slow healing sores. Treatment for PAD can include lifestyle changes, medications, or surgery. Number 2. Neuropathy is a condition that causes damage to nerve endings. This can lead to muscle cramps, especially if the nerves that control muscle function are affected. Some other possible symptoms of neuropathy include numbness, tingling, and difficulty with coordination. Treatment for neuropathy can include medication, physical therapy, and lifestyle changes. Number 3. Hypothyroidism is a condition where your thyroid gland doesn't produce enough hormones. This can cause muscle weakness and cramping. Other possible symptoms of hypothyroidism include fatigue, weight gain, and sensitivity to cold. Treatment for hypothyroidism can include medication and lifestyle changes. Talk to your doctor to determine the underlying cause and find appropriate treatment. Preventative measures for muscle cramps. There are many natural remedies that can alleviate and prevent muscle cramps. Some of the most effective measures include: Number 1. Hydrate. Drinking plenty of water throughout the day can help prevent muscle cramps caused by dehydration. Proper hydration is vital not just for overall health but also for the proper functioning of muscles. Maintaining an adequate water intake reduces the likelihood of muscle cramps and other related complications. How much water do I need? Generally, the recommended water intake for adults is 8 8-ounce glasses of water per day. However, the amount of water needed varies depending on individual conditions such as body weight, activity level, temperatures, and medical conditions. For instance, people who engage in intense physical activities and sweat a lot will require more water to stay hydrated. Why is hydration crucial for muscles? Our muscles are made up of about 70% water. This makes water an essential component for maintaining their function. When you do not drink enough water, your muscles do not get enough fluids, leading to dehydration. Dehydration means that your muscles will have less sodium, potassium, and other electrolytes, leading to muscle cramps. Tips to include more water in your daily routine: drink a glass of water in the morning immediately after waking up. Keep a water bottle with you all the time. Sip water during meal times. Flavor your water with slices of fruit or vegetables. Make a habit of drinking water before, during, and after exercise or strenuous activities. Number 2, stretching. Proper stretching before and after exercise can help prevent muscle cramps. Be sure to stretch your calves, hamstrings, quadriceps, arms, back and chest. Nutrient supplements. Muscle cramps can be a frustrating and painful experience for many athletes and fitness enthusiasts. Fortunately, there are certain nutritional supplements that can prevent muscle cramps and help you perform at your best. Number 1, magnesium is essential for muscle function and can help prevent cramping. The recommended daily dose for men is 400 to 420 mg, and for women, it is 310 to 320 mg. Magnesium can be found in spinach, almonds, dark chocolate, and supplements. Number 2, calcium is crucial for proper muscle function and can help prevent cramps. The recommended daily dose for adults is 1,000 to 1,200 mg. Calcium can be found in dairy products, leafy greens, fortified foods, and supplements. Number 3, sodium is an electrolyte that can prevent dehydration, which is a common cause of muscle cramps. The recommended daily intake is around 1,500 mg. Sodium can be found in table salt, pickles, and sports drinks. Number 4, vitamin D helps the body absorb calcium and improve muscle function. The recommended daily intake for adults is 600 to 800 international units. Vitamin D can be found in fatty fish, egg yolks, and supplements. Number 5, potassium is an electrolyte that helps prevent muscle cramps by regulating fluid balance. The recommended daily intake for adults is around 2,700 mg. Potassium can be found in bananas, avocados, potatoes, and supplements. Before taking any supplements, it is important to consult with a healthcare professional to determine the appropriate dosage and possible interactions with any medications you may be taking. As with any supplement, there may be side effects, such as diarrhea, nausea, and upset stomach. Mindful exercise. Exercising regularly, but smartly, at a moderate level without overuse or underuse can prevent muscle cramps. Massage. Regular massage of the muscles can increase blood flow, improve nutrient delivery, and help prevent muscle cramps. Chiropractic. Not only does proper spinal alignment relieve muscle cramping, but it also has numerous other benefits such as improved blood flow, increased muscle movement, and improved musculoskeletal function, all of which help to diminish instances of muscle cramping so that your body can feel at its very best. Muscle cramps can be painful and disruptive, but understanding the causes and how to prevent them can alleviate their impact on our lives. Proper hydration, nutrient intake, mindful exercise, stretching, chiropractic and massage can all contribute to preventing and managing muscle cramps. With proper preventative measures, individuals can optimize their body's function to live a more comfortable and pain-free life. Thank you for watching. If you have any questions, leave them in the comments below. Be sure to like and share the video and subscribe to my channel so you don't miss out on more great tips and strategies.